Welcome to this Whole Life Action Hour. I'm Ocean Robbins, your host, and today we're going to be talking a bit about pain and pain management and how to make healthy choices that support your body to have peace and wellness. We're going to be talking today with Dr. Anna, who is an expert on this topic. And chronic pain affects millions of people all around the world, but there are natural and effective ways to find relief and improve quality of life. So in this action hour, we're going to share some valuable insights on how you can harness the power of holistic healing and incorporate nutrition and mindfulness practices to alleviate pain and nurture more ease and more vitality. We're going to look at the benefits of anti-inflammatory foods, targeted exercises, and building a support network to help you navigate the challenges of chronic pain if that's something you're facing. So, little context, this is a project of Whole Life Club, which is Food Revolution Network's ongoing membership community. Some of the questions I'll be bringing to this interview come from Whole Life Club members. Nothing you hear today is medical advice. We're offering coaching and our own best insights, but always consult with a qualified healthcare professional regarding your specific healthcare realities and needs. Okay, so Dr. Anna Steindorff Pinheiro, whose name I am probably not pronouncing very well because as an American, we aren't schooled in how to speak German and many other languages well, but I'm so glad she's here with us. And that's, in fact, I'm just going to ask you to say your name properly so we can all hear it as we get going here, Anna.
Anna Steindorff Pinheiro.
Okay, wonderful. Thank you so much. So, Dr. Anna is a visionary physician who is based in Berlin, Germany, with a focus on treating and reversing chronic diseases and chronic pain and co-treating cancer. Her approach is grounded in the principles of plant-based nutrition and sleep, medicine, and physical activity and recovery. As a pioneer in environmental and body-mind medicine, Dr. Anna addresses the root causes of ailments, embracing a holistic approach to healing. And her expertise extends to addiction cessation, particularly in smoking cessation, and aiding patients in reducing reliance on medications like antidepressants, tranquilizers, painkillers, and sleeping pills. Throughout her extraordinary career, Dr. Anna has championed patient-centric approach, and she is transforming lives with her personalized treatment plans and compassionate support. Anna, welcome. Thanks so much for being with us today.
Thank you for your invitation, and I'm happy to try to help as many people as possible.
Okay, thank you. So let's talk a little bit about chronic pain. Of course, pain has many different shapes and dimensions. Chronic pain isn't just a temporary discomfort, it's an ongoing and persistent sensation that can impact daily life. Unlike acute pain, which is like a normal response to injury or illness and usually resolves when the body heals, chronic pain keeps on going. It becomes normal. Sometimes it even creates cycles of inflammation that lead to more pain. So, can you tell us a little bit about the key differences between chronic pain and acute pain, and why understanding these differences is so important for developing effective pain management strategies?
Yes. So, acute pain has a biological purpose. It is there to protect us from injury that is happening or might happen in the near future. So it makes sense, it is important, it is objective. And normally it lasts under a month. Sometimes it's very quick, like when we burn ourselves in a candle. It's just for a second and we protect ourselves by moving away from it. Chronic pain is totally different. It's a pain that lasts at least for the last 3 months. And in doing so, as no one likes to have pain, it means that we cannot treat it correctly or it is actually untreatable. And we don't know the cause. It's subjective. People try different approaches. And the important thing also is that it it changes the whole person, because if you have pain, you don't feel well, and that in itself becomes a vicious cycle and becomes a problem in itself. Even if you resolve the pain that was causing it, sometimes people get so stuck into this vicious cycle that they don't know how to live anymore, because it
Mm-hmm.
all gets influenced, and there's a lot of emotional distress in the patient and in the problem.
Thank you. How does chronic pain affect a person's physical and emotional well-being? Can you take that a little deeper? What are some of the common challenges people may face when they're living with it? And for anyone who is suffering from this, maybe as you hear this, you can feel a sense of not being alone because these are common dynamics.
Yeah. The problem is, as I noticed, it affects the whole body. So we become depressed, we become frustrated. Why can this not be treated correctly? We become angry, we become fatigued, we are anxious, we stop seeing friends and family. Maybe we stop working because we cannot go to work. And all these things have a vicious cycle that
Mm-hmm.
each one makes the next one worse. And so it's very important to help someone get out of this cycle that is influencing, we say always, the biological, the psychological, and the social part of the person. And people often get trapped in it and cannot find
Mm-hmm.
the way out again. That's
Mm-hmm.
our job as pain management specialists.
Thank you. What are some of the root causes of chronic pain? The most common ones.
Well, you can divide it in three big themes. One is muscle skeletal pain, one is pain from the nerve itself, that the nerve gets sick, like after a stroke or in polyneuropathy. And then there is pain that comes from inner organs, like the gut or the brain with migraines or something. So these are the three basic parts of chronic pain. And as you see, it has so many different causes that there is no real one pain therapy for all, because it all depends on what's the problem that is underneath the pain. Because pain is just a signal, it's a signal that something is wrong.
A lot of people dealing with chronic pain turn to sustained use of pharmaceutical medications to help manage it. And um, can you tell us a little bit about how the primary categories of pharmaceuticals that are used, such as NSAIDs and opioids and so forth, and also, um, how they work and what their downsides are?
Yes, pain medications are specifically treating pain, but pain is a signal. So we are treating a signal and we are not treating the cause. That's the biggest problem of pain medication. Because if we want something to stop forever, to get a sustainable, healthy body and mind, we need to treat the cause. If we treat the pain with pain medications, and often we have to because they are so bad that you have to do something about it. We all have to be very careful about it, because we all have to see that we are not treating the cause, we are just treating the signal. So it will never be possible to say, oh, let's treat this pain for 1 week and then stop. We are always talking about long-term therapy, and this is the biggest problem. With acute pain, we give medication for a week or a month, even if it has side effects or complications. It is such a short period that you are not supposed to have long-term problems with it.
Yeah.
With pain medications that you take long-term for more than 3 months, as the definition of chronic pain is, or for a lifetime, this is becomes a big problem. And so we have uh, two different classes of medications. As you said, they are non-opioid pain medications and opioid pain medications. in the non-opioids, we have things like acetaminophen and ibuprofen, uh, which are pain medications that might help a little bit. And then we have other pain medications that are special for pain therapy, which treat or try to treat the nerve by itself, calming the nerve, like anticonvulsive medications, which try to reduce the irritability of the membrane of the nerve, like after a stroke or if you have this polyneuropathy. And then you have medication like antidepressants that also show some degree of pain therapy potential, let's say
Hmm.
like that.
Yeah.
I am more into trying to find the cause, because that is the only possible sustainable way to treat this disease in the long run. With pain medications, you can have liver failure problems in the long run. You can have renal failure. You can have heart disease. You can have uh, peptic ulcer disease. So it's always good to try to use as little as possible, because, as I said, they are never treating the problem. They are just treating
Right.
the signal. So for sustainable health, we have to go deeper than that.
Yes, I think that's why we're here today. So let's go deeper now. As we look for more sustainable pain management options, root cause is so critical. In your experience, what about diet and lifestyle is often connected to root cause, or how can diet and lifestyle help address that?
It depends so much on the cause. So
Hmm.
you have to, at first, uh, we lifestyle medicine specialists, we are like detectives. We have to go deeper and not just keep it, oh, this is chronic pain, we don't know the cause, let's treat it with pain therapy. This doesn't work for lifestyle medicine. We have to be like detectives and search for the cause. And even if it's sometimes painful, sometimes it's difficult, because, for example, if someone has neck pain because he's always using the computer, we have to address the this problem, and we have to say you have to stop using the computer and you have to find another job that is outside in the real world,
Mm-hmm.
and nothing else will ever have the same impact. And what I find is that this a message has to be very clear, and because it it follows that it the patient has to change, and change is hard and no one wants to change. So we have to be very, very clear what is the most important change that brings the most value to the
Hmm.
patient's life in that moment. That's the one thing. The other thing is, then, with the lifestyle perspective, I use 5 different components of lifestyle medicine. I use the food in a whole food, plant based, low fat, with minimally processed food diet. Then I use sleep therapy, and to make sleep better in quantity and quality. This is for pain patients especially important. I use movement as a therapy with 3 different components, because patients who have pain don't move. It's clear you
Hmm.
cannot move with pain. So first we do passive physical therapy with heat and massages and other things that make sense depending on the cause. Then we do active physical therapy with a physical therapist that helps specifically with this disease and this patient. And then we progress to free movement and sports and exercise, but always never forgetting that, as I said, when you are 10 hours at the computer, this is cannot be reversed by going 1 hour to the fitness room,
Hmm.
because this sedentary lifestyle and all this muscle aching that you get by looking straight the whole time, it was not intended by nature. And so it's very difficult to treat anyone effectively in the long term if you don't address all these different parts.
Hmm.
And then this is a little bit also already inside this is the environment. That's what I mean with the working environment, the life environment, the how do you go to work, do you take a bike, do you take the train. And
Yeah.
then the fifth part is the body mind part, that is so important, especially here because of this emotional distress. We want to be a guide and help these people trapped in the pain and trapped in loneliness and missing a life purpose often, to help them get out and find their life mission and to be happy again. We can often not take the pain away at all. We have to be very clear that if someone has no pain, we are dead. It will
Hmm.
never happen, uh, and we have to be serious about that. But I think that this mind body part is there to, like a volume. You can put the volume up with pain, you can put the volume down with pain. You can also use the cycle, this vicious cycle, the other way around. One makes the other better, and the other better, and the other better. So that's why I mean with this mind body part of this, and we use it by making the social bonds stronger. We use it by reducing stress. We use it by reducing the addiction that happens not only with this opioids but not opioids, and also with different foods that people have problems. And most of all, we use it for motivating the person to change and to try to become a better self and to have hope in the future, because people lose hope when they have pain for a long time.
Yeah, absolutely. It it strikes me. I'm a dad, and when my kids were little, when they were babies, they'd sometimes cry. Not just sometimes, a lot. And you talked earlier about detective work. With a parent with a crying baby, there's this detective work of like, why is the baby crying? The most obvious things you learn about are they hungry? Do they have a dirty diaper? Do they need to be burped? And then there's other things that could pop up over time as well. So you kind of have to address it, and that's a signal. That crying is a signal that the baby needs something. It needs some attention, right? And um, and most of us who are good parents or try to be good parents wouldn't just be like, "Shut up, let me stuff something over you so I don't hear you anymore. I'm going to go on with my life." We want to listen to the baby, right? So I'm thinking of that as a metaphor for pain in our own bodies, and how often when we experience a signal of discomfort, we try to tune it out, medicate it away, ignore it, right? Um, and there's, at least for me, sometimes on my better days, when I experience a discomfort or pain in my back, I get curious, and some part of me asks, "Hello, pain in my back. What would you like to tell me?" And I notice that maybe the pain in my back is an indication that I need to move my back around, or I'm sitting in a not great position. And if I keep tuning it out, it's going to get louder and louder, like a baby that's eventually screaming, right? And so learning to listen is like, you either do it now or you do it later. And sometimes there's a bigger price if you delay. So those signals can be very important. Do you see it similarly? How do you bring sort of compassionate witness to those signals?
Yes, I see it in a similar way to most people that have beginning pain.
Mm-hmm.
Uh, this this is good. Pain is good. It's a signal that it's telling us something is wrong and we have to change. It might be not that comfortable. It's nice to be in the couch watching TV, but maybe you have to go and make some special weight exercises so your back is strong and healthy. Go for a walk or something like that. The thing is, we always have to also be compassionate with people that have a lot of pain, and people
Yes.
who have a lot of pain, it's very crushing for them if we
Yes.
say, oh, just think about a nice thing and go with your friends and all is well.
Mm,
So we always
yeah.
have to be very compassionate with people who have real bad pain. And
Right.
I hope to say that we can always regulate the pain down.
Mm-hmm.
And I'm sure to some degree we can, but we have to accept that some pains are very difficult to treat and that we will never get them to be without pain.
Mm-hmm.
Not a minute in their lives, probably. So we
Yeah.
also have to be very compassionate about people like that,
Yeah.
who are maybe trying their best, but maybe there's something else that some can try which has not been tried yet, and it makes sense to keep searching and to keep trying and never give up.
At its core, do you feel like a lot of chronic pain is linked to inflammation or is fueled by inflammation or is intensified by inflammation in the body?
It depends very much on the chronic pain because there's no tip, or maybe the typical chronic pain is muscle skeletal pain, and there I can say yes, you are right. It's
Mm-hmm.
a lot about movement and a lot about diet and about anti-inflammatory diets, which really help to reduce the inflammation and the pain, and
Mm-hmm.
in rheumatic disease, for example, in back pain and neck pain and so on.
Mm-hmm. Yeah. So how particularly does a whole foods plant-based diet sometimes provide benefit? How can it help for some people?
So in a whole food plant-based diet, you have different degrees of help. The first obvious thing is you stopped eating oxidizing food that are so inflammatory triggering that it's difficult to compensate it with good things in afterwards. So like fried foods like sausages, and then there's a second level that is less triggers, specific triggers, like milk is a specific trigger for many different rheumatic disease. And so you stopped that as well. That's
Mm-hmm.
the second good thing. Then there's the third level, which is eating a whole food, plant based, low fat diet with minimal processed foods. Then you are not only leaving the oxidizing foods and the triggers, but boosting your diet with food that protects you instead of doing you harm. And then there's a fourth level that is, if you do that all good, then you can top it up using specially antioxidant rich foods like curcumin
Mm-hmm.
and so many other things like spices uh, and I often tell people to eat a smoothie, to make a smoothie every day, and all these highly antioxidant rich foods that are so important for us, like the even the omega 3s, the short chain fatty acid omega 3s, the long chain fatty acid omega 3s. We all put it in a smoothie and blend it, and then the not so good tasting things get blended with real good tasting things, and then you drink it 3 times a day, and it's a joke to become healthier and to help with anti-inflammation for your pain. Yeah.
Thank you. You mentioned curcumin, which of course is one of the primary compounds in turmeric. I think it deserves maybe special mention. Can you tell us a little bit about turmeric and bioavailability? And do you recommend curcumin supplementation of some kind, or just eating lots of turmeric with the right cofactors for absorption?
Yes. I am a big fan of real food because real food is the one that has proven in the articles and in science on and on that it helps much better than any supplements can do. So I here it's called curcuma, is called the turmeric. I was changing
Oh,
the,
you meant turmeric.
yeah, I
Yeah.
meant turmeric.
Uh-huh. Yeah.
So I always recommend using real turmeric. I'm a very big fan of real fresh root turmeric. So I always recommend to use it in the smoothie. But I think using it in the curries, using it a little bit more on here now, it's very much in vogue to put some to make a golden milk with turmeric. So there are many possibilities, but I find it the best to make a smoothie and then to
Hmm.
put all it inside, and like pepper to help to absorb the turmeric.
Hmm.
And not only that, but also the berries and the flax seeds, for example,
Hmm.
and the spinach or arugula or some other green leafy vegetables, and then really to take it as if it was a medication 3 times a
Hmm.
day, because it's important to keep the levels up the whole day and not just do a good start in the morning, but then as the day creeps, we get tired and we start uh, to have to make food decisions that are not as good. So it's important to plan ahead and to have a smoothie like that for the extra topping, as I say. But the other three parts are more important to rule out first,
The other three parts being.
being the eating whole food, plant based, low fat food with minimally processed
Hmm.
components, and no meat, no sausage, no milk. That's the no oxidation, no triggers, and then whole food, plant based, and then the toppings. Because the toppings
Yeah.
alone are like a medication; it will not work. You can
Uh-huh.
never out out um, therapy a bad diet with a nice smoothie or something.
Right.
You always have to do the basics first, and only when you are excellent and successful with this level and this basic, then you proceed to the next level, because
Yes.
we all know that we all like quick fixes. So I always have to say that, because we all tend to want quick fixes and not change. And change is the only thing that makes your health in the long term really sustainable, in a way that you don't need then medications anymore.
Thank you. Um, Fascinating. Well, of course, people will be interested, especially in this audience, in all of these dimensions. But in terms of the what you call the toppings, the which are the like this the superfoods, if you will, that are extra helpful after you've got an ecosystem of wholeness. Um, Turmeric. Let's talk about some of the others that are potent. You mentioned berries. What is helpful with berries and pain management or anti-inflammation?
In real, we don't know, because it's like Colin Campbell says, it's the whole thing that makes it such
Hmm.
a miracle. And we we can say, oh, it's the anti-inflammatory part, or it's the stabilizing of the membranes, or it's the making the vessels heal again. And so if we
Mhm.
have a good functioning cardiovascular system, then we can heal ourselves, because the nutrition goes into the cartilage, which normally is not well fed. And all these kinds of things, I think it's a myriad of things that come together. And I cannot say it's one small little detail, because as we know, we tend to then skip the basics, and I don't want to
Mhm.
skip the basics.
Mhm. Yes, yes.
So
Um, oh, go ahead.
no, that's the, I think it's really the nutrition of the vessels, of going deep into the vessels, because the blood is much thinner than in people who eat animal products, and the vessels get not stuck with some fats, and then the anti-inflammation, and then we reduce the immune triggers. So it's so many different levels, and berries
Mhm.
will help with every one of them. So,
Mhm.
and it's just one example, it's so many, it's the green leafy vegetables, and everyone helps with so many of these different parts.
Yeah. You didn't mention ginger. I'm curious if you find that helpful for some people.
Yes, ginger is sometimes probably not as good as turmeric, but uh, sometimes we try different approaches, like
Mhm.
1 month more turmeric, 1 month more ginger, 1 month more other spices, you know,
Mhm.
like cinnamon, like mm, mm, don't have the words in English, sorry. But there are some other spices, and we can
Yeah.
try to rotate them, and that's one part. And rose hips, I think it's called. It's another
Mhm.
possibility
Yes.
for the cartilage, for example. And we can try different uh, therapies like that. But for me, it's a real important to not forget the basics, and the exercise and all these, because one thing
Yes.
alone will never work. That's what normal physicians criticize. It's like, you think rose hips will help with
Mhm.
osteoarthritis? That's a joke. It is a joke, because that one thing will not be possible to
Mhm.
change such a serious, long-lasting disease. If it was, it would be very easy to treat that. That would be not a chronic pain problem. So
Right. Right.
we always have to see that it's not one thing, it's the cocktail of many things that can help and make a difference, and even, as I say, treat the cause.
Yes, thank you. And some of these things work in synergy, and occasionally we figure out a really dramatic synergy, like you earlier mentioned turmeric and black pepper, and it turns out that bioavailability of turmeric increases up to 20-fold when there's black pepper present. And
Yes.
so just having a little sprinkling of black pepper in there, most people don't put black pepper in their smoothies, but if you want to absorb turmeric, you should. Not a lot, just a little bit can make the difference. And there are so many examples like this where foods work together in remarkable ways. So I love how you're thinking about this whole picture. And of course, every food itself is a whole symphony of compounds. Our body wasn't designed to digest, isolated items. It was designed to digest a whole, and so nature works in remarkable
Yes.
ways.
That's
Um,
why supplements don't work very well, because in
right.
a supplement you always have to give just an extract of something. That's why I recommend smoothies. But as you say, I try to use these that have a win-win, that help in a
Mhm.
synergistic way. As you say, it's sure.
Yeah. Despite all our best efforts, Some people are still going to be living with pain. And so it's important to have hope, and it's also to have important to have compassion. Um, how important is social support, loving connection, people to soothe us, to hear us complain, or maybe to give us hope when we've lost it? How does social support fit in, and how do people maximize that to help them cope, or perhaps even perhaps heal?
Yes, social support is really a paramount factor in this, because as I told you, it's like this volume. You turn it off or you turn it on, and the pain is still there, but it's so different. And we have to see that many people who are in pain for a long time, they already are lonely because they haven't gone to meet people. So the best advice I give to them is to first seek self-help groups, and but not stay only with self-help groups, because you can also linger in the pain. I recommend very much to look for exercise groups of people who have diseases, or who have the same disease, or at least the same disability. Because sure, you don't want, if you have um, aching pain in the legs, you don't want to go for a walk with a 20-year-old who is running. So
Right.
it has to be, you have to look for people that can do something similar, and uh, the effort is similar to your effort, because then it's a positive thing, and you don't get negative feedback thinking, oh, I cannot do this, I can never do this, this is not helping me. And sometimes you can find groups with the same diseases, and so it's very easy here in Germany. The It is very common, for example, heart disease groups, and I like to accompany them, because they really become a very strong bond. Sometimes even stronger than their family, their spouses, because they had a heart attack. They had this very big moment in their lives where they uh, were afraid of death, and so then it becomes a very strong support. And so it's better, before going out in the open and look for lost friends and family or something, it's better to start with groups that have more compassion, more understanding, and maybe are in the same position. And of course, if you have this problem, also go and consult cognitive behavioral therapy specialist, a psychologist, who can help you on this way out of this vicious cycle.
Yes, thank you. How helpful can meditation or prayer or faith communities or um, visualizations, are some of these things helpful for some people?
Sure. We know there are some studies about imagery, for example, for cancer patients. We know that in general, stress is a bad thing, and that it makes, again, the volume higher of the membranes and of the nerves, that become more easily triggered to signal pain and signal strong pain. And so there's one therapy that I recommend a lot, that is mindful based stress reduction. This is a 8-week program where people learn to meditate and to calm themselves. That more than anything, it's to learn to accept life as it is, and to accept that pain is here, and feel the pain, and accept it, and not be
Hmm.
angry, and first of all just accept it. And then also to have expectations, not I want to have zero pain tomorrow for the rest of my life, but to have expectations that are possible to reach. Like, I want to be able to walk around the lake. I want to be able to play with my son outside. That is much, much more interesting than always just trying to see, do I have pain? How much pain have I now? And is it bad? Is it worse than yesterday? Oh God, it's worse. Why isn't it going away? And then you start again in this cycle. So
Yeah.
this MBSR, this mindful based stress reduction, helps to filter and look in the long run. And always this is just regulating the volume of the pain, because if pain is there or not, you can only change with treating the cause, which might be real easy to treat, like a patient that has neck problems and becomes another worker, changes his job. Or I had a young patient, a 30-year-old woman who had migraines and headaches since her childhood. She remembers that being in high school, she missed school a lot because of that, and she did different interventions, pain medications, and so on. And in the end, we discovered she had a histamine intolerance. And so it's not just uh, eating a whole food plant based diet that helped with her, but we had to leave off bananas and so many different fruits and dates and so on, to specifically treat that problem. And with her, it was especially uh, bad because she was given medication and antidepressants, which in itself uh, hinder the metabolization of histamine in the body. So they make the histamine even higher and made the pain even worse. So it's all about then stabilizing with these different factors, and then taking away the medication that is hurting her, giving her a diet that is free of histamine, and then trying to help her, because people who have pain for 20 years and they are 30, they cannot snap out of it in a minute. All life has to be learned to be lived again. So it's important to do the walk and be there with them for the whole time.
Yes, thank you for that. I'd love to move now to some of the questions we've received from Whole Life Club members. Judy said, I have scaphoid osteoarthritis in both hands from a fall I had last year. I was diagnosed by x-rays. I experience pain all the time in my hands, and it's difficult to do the things I used to do with my hands. Can you recommend anything to deal with this pain?
Probably this osteoarthritis was there before already. It just didn't hurt. It was like sleeping. So ideally, we have to send it to sleep again, and we probably do it with with splints, with physical therapy, first passive with hot and cold baths, and then with small movements, and then making the hand stronger again. And we do it with the food, with the inflammatory food that we talked about before.
Thank you. Um, Brasha said, I have a friend who has recently been having trouble with sciatica. Any suggestions of what can be helpful with that?
Yeah, so with sciatica, the first thing is to see if it's real sciatica with a real nerve problem that is being crushed in the spinal cord, or if it's a muscle problem that is in the back or in the leg, and that needs to be treated very, very differently. And we can make some physical sign tests and even do an MRI scan and to check to see for sure. But in general, the general part is the same for both. It's first physical therapy that is passive with heat and massages, then physical therapy that is active with movement, and then it's exercise and weight trainings, especially if it's a muscle problem. Exercise, weight trainings, mobilizations. Sometimes that there are trigger points in the muscles that need mobilization with a tennis ball or with a TRX roll. So you can use um, different parts of this is many times more real a physical problem and more than a food problem, although we know that normally the vessels that go to the back are very small, and if in the part of the back where they are not working correctly is normally the part of the back where people have more pain. And this makes sense because we know that if there's injury in the back, the body needs to give more nutrients to that part of the body to heal itself. And if the vessels are not working, then we cannot heal as we used to maybe 20 years ago. So then it might be important also there to see to change the diet and to make the nutrients flow to the site of injury the best possible.
Thank you. Um, Karen said at age 71, I often find it difficult to know if my pain and fatigue is part of normal aging process or a symptom of some kind of disease. Do you have any helpful guidelines? And if I do need to see a doctor, are there any specialists for pain or fatigue? There are a confusing number of specialists out there.
Yes, that's a very interesting question. Uh, I think the first thing is you go to your general practitioner because he can do basic tests and then say, oh, it's probably more the nerves, and I send you to a neurologist, or it's probably more the musculoskeletal, and I can send you to the orthopedic. Or you can try to first, with the help of a lifestyle specialist, or first yourself, to see if you can get better by yourself, uh, moving more, eating more whole food, plant based, low fat, no processed foods, more anti inflammatory things, and then see if there is something getting better. Because in the end, it's interesting to know, oh, is this a disease or is it just getting old? In the end, you can treat both with lifestyle medicine, and in the end, maybe it's just a theoretical question. I'm sure if you have a specific, very sharp pain in one part of your body, probably there's more to this than just getting older. If the pain is one day here, one day there, one day one foot, one day another, probably it will be more aging, I would say, in general. But work your best and see if it's possible to reduce, because aging is also possible to reduce the effects of aging.
That's right. And a lot of the principles we're talking about today, and that we talk about a lot in Whole Life Club, are all about that. Marcella asked about after you've run out of natural ideas for pain, she's asking about the sort of what's best if you need to take something pharmaceutical, from especially for gut health, aspirin or acetaminophen or ibuprofen or naproxen sodium, or what are your thoughts?
Yeah. Aspirin, I think, is never a good option for chronic pain because it has blood thinning effects, and these are a real danger if then you fall, you trip, if you have a car accident. So I would be very caution to to take aspirin in the long run just for that uh, problem. Ibuprofen is a possibility, but it has the big two problems of heart disease and of renal failure, and the third one of gastrointestinal unease and peptic ulcers. So the safest, if taken in very low doses, is probably acetaminophen. Although this, as probably know, if taken in higher doses, is very, very, very damaging for the liver, but in low doses is an option, although it isn't very strong. And my patients normally don't want to take it because they say taking that or taking water is the same thing. But it
Uh-huh.
is a little drop, but I know that it's not uh, uh, very happily taken by
Mm-hmm.
people.
Yes. Thank
But
you.
it's the best
Um,
option, let's say like that.
okay. Thank you. Rima said, my daughter's 14 years old and she has stomach cramps during her menstruation period. And she's asking, are there any natural ways to reduce this pain? She's a plant-based eater except for cheese.
Yes. For that pain, I see two different approaches. The first thing is in the moment where the pain is there, put heat on the pain. So there are electrical pillows, there are some cereals you can heat in the microwave, or hot water bottles or something like that. But keep the hot for at least half an hour, and slowly the pain will at least diminish. And the other thing is sometimes women have aches like that in the tummy because the hormones are not in a perfect balance. And
Mm-hmm.
so eating a low food plant-based diet with extreme caution about oils and nuts and seeds helps to gain the balance again of estrogens and progesterones. And then sometimes it's possible to, in the long run, reduce the pain by helping the hormones be in a better equilibrium.
Thank you. Yolanda said both my parents have arthritis. I have arthritis in my left knee. I'm wondering what can I do to prevent arthritis from appearing in other parts of my body? Any thoughts about arthritis here?
Yes. As we said, arthritis is in the cartilage, and the cartilage is not well nourished. So we need the compression and decompression of walking and movement. So one essential thing is walking every day. The second is not being sedentary, because it's a different thing. You can walk for an hour and then be at the computer for 8 hours, and this is bad. You have to or get up at least once every hour. Better would be to have a standing desk and walk a little bit, and to help compress and decompress so the nutrients can walk to the cartilage in this joint, and to help it get more nutrients. The other part is, as we said before, to make the vasculature better, reduce the cholesterol and reduce the fats in the food, so the blood is thinner, so it gets the nutrients to the last few resorts. The other part is eating a diet that has many antioxidants, so the inflammation that happens can be calmed by natural antioxidants. and and in um, this uh, holistic therapy is the best option for this, but it is a difficult one. And then also mobility. So going to end of range mobility in the joints, so your body doesn't stop um, knowing how to move until the end of the joints, because we know someone who has osteoarthritis uh, in the late stages, they are crippling and they don't have mobility anymore. So this is another part that is important and also helps the nutrients to get there.
Yes, thank you so much for that. And then let's see, we're almost out of time here. One last question came from Denise, who said, "What do you find helpful for muscle tension?"
Muscle tension is again a thing that is a lot about sedentary lifestyle. And so we start with heat and massages, then we move to active physical therapy, and then we move to movement. Being movement, always two parts: exercise and not being sedentary, because it makes no sense to exercise and then look at the screens for hours and hours and without end, because the body, we have to think of the stone age. The body was not made to be in one position for a long time. They were
Right.
always rotating and standing and sitting and walking and standing and sitting and walking, and this is what we have to mimic if we want to have a natural health and and fight our diseases in a natural way.
Yes, thank you so much. I so appreciate your thoughtful, informed, compassionate presence in this area. Pain, especially chronic pain, can be so debilitating. It can sap our will to even live at all. And your steadiness, your understanding, like sometimes some things won't be solved, but also there's so much we can do. And your holistic approach are so heartwarming, and hopefully will bring some peace and some joy to a lot of people's lives. Dr. Anna, thank you so much for being with us today.
You're welcome.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club.